Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and hello, everyone. I hope you and your families had a good holiday, and I want to say Happy New Year. May 2021 be better than 2020. I am pleased to begin today by saying our cases so far are moving in the right direction. They're coming down. We're reporting 3 new cases of COVID-19 today. All of the new cases are in the central zone. 1 is travel-related and 2 are under investigation. There are currently 19 active cases in our province and no one is in hospital. We still don't have all the epidemiology from the holiday, but I want to say thank you to everyone for your cooperation in following the protocols. Today we announced our vaccination strategy for the next 3 months. Dr. Strang will have more details on that in a moment. But let me say I am pleased that where we are today. Between now and June, we're expecting over 1 million doses of vaccine, which means we'll be able to vaccinate more than half of our population. Starting tomorrow, we will continue the vaccinating frontline healthcare workers, and every week after that, as the vaccine arrives, we will run clinics across the province to ensure our most vulnerable are vaccinated. Frontline healthcare workers, to seniors living in long-term care, and those 75 years and older living in communities. Our strategy is to conduct clinics in all parts of our province, and this will help us keep the vaccination program rolling. So if, for example, if we get a shipment larger than we are anticipating as it arrives, wouldn't that be a good problem to have, getting more vaccine than we expect to get? We will be ready. What we've learned now in the first few weeks will help us become more agile. We know how to move the vaccine and how to quickly get it into the arms of people who need it, rather than have it sitting in freezers. Dr. Strang is going to give you more details, but I just want to reassure all Nova Scotians that we will continue to communicate with you as the vaccination program rolls out. Dr. Strang.
Thank you, Premier, and Happy New Year to you. Good afternoon, everybody. And I do want to wish all Nova Scotians a Happy New Year. As I said, as we close 2020, 2021 brings hope, and I truly believe that. And I do hope that everybody had a chance to rest and safely connect with friends and family over the last couple of weeks. As the Premier said, today we are reporting 3 new cases of COVID-19 in Central Zone. 1 of them is related to travel and the other 2 are under investigation. Since October 1st, there have been 419 cases of COVID-19 in the province in total. 400 of those are now considered resolved. That leaves 19 active cases across all 4 health zones, and we are fortunate that we have nobody at this point in time in hospital. So I know that many people are watching and waiting to see the impact of the holiday season and how what happens with COVID-19. The restrictions that we had in place at the end of November put us in a good position going into the holiday season. And then the ones that we had to further enhance restrictions on December 21st onwards have helped us to hold that ground while still allowing small gatherings of up to 10 people and some travel within the province for people to be with family and friends. So it's still early. We're not yet 2 weeks from the peak of the holiday season, but our early indicators are, by and large, encouraging. We've seen fairly stable single-digit new cases each day. The number of active cases continues to go down. Most of our cases are linked to other known cases or travel outside the province. And the number of close contacts and exposures for each case are staying low. However, several of our recent cases, and there is at least 1 in each of the 4 health zones, we're at a point in our investigation where we still have not been able to identify a clear exposure. So that is a signal that we still need to remain very cautious when it comes to COVID. So while the early indications are generally encouraging, and I do want to thank everybody for all their hard work throughout 2020, that work and that caution has to continue in 2021. Nova Scotia is a very safe place to live in the world right now when it comes to COVID, and we don't have to look very far from our own province to see that. The second wave of COVID is all around us, and so is the potential for the new, as we see emerging new strains of COVID, they bring additional concern, and so we have to pay attention to those as well. So if we're going to keep our province safe, we need to remain vigilant and cautious. This week, we are looking at the restrictions that are currently in place and how we might be able to start to loosen those. There's more discussion in the next couple of days. But when we are able to lift or loosen restrictions, it will be slow, cautious, and deliberate, keeping the safety of all Nova Scotians as our first priority. The first step that we made towards a slow reopening did happen or was implemented yesterday when the bars and restaurants in Halifax were able to open their doors to in-person dining for the first time since November 26th. There are still restrictions in place for bars and restaurants across the province. The food and beverage service has to end by 10 p.m. and they have to close to in-person dining by 11. And they certainly have to continue to enforce all the usual rules around physical distancing, keeping in close social groups of no more than 10, wearing masks, etc. And I would like to thank the restaurant and licensed establishment operators across this province for working with us constructively despite the significant financial impacts on their sector. I want to move on to a quick update on our COVID vaccine rollout. There was a technical briefing earlier today, but I want to touch on some key points. So as people may know, we got a total of 9,550 doses of both the Pfizer and Moderna vaccines in December. The last delivery was December 30th when we got our 3,700 doses of Moderna vaccine. This early vaccine has given us a chance to test our processes ahead of our phase 1 rollout, which began on Monday this week. We have always been anticipating to start our vaccine program in January. Early December, it was confirmed that we would get some initial small doses of vaccine in December, which allowed us to test some of the processes slightly earlier than we thought we would be able to. So far, we've been able to provide over 2,700 doses of the vaccine to frontline healthcare workers and some long-term care staff in Central Zone. And the reason it's in Central Zone, as we've said before, is simply about the very strict requirements around handling the initial shipments of the Pfizer vaccine. We've held back the same amount of 2,700 doses to ensure that these individuals get their second dose within the 21 to 28 day window period. That 21-day period starts on Wednesday, January 6th, and we have clinics to start providing the second dose on Wednesday. And we've set aside the 3,700 doses of Moderna vaccine to begin to provide that vaccine to residents, staff, and caregivers at the province's 3 biggest long-term care homes, the Shanix Parkstone facility in Dartmouth, Northwood's Halifax campus, and Ocean View Manor. And this immunization with Moderna vaccine will begin very soon, now that we have a process in place to ship this vaccine to the long-term care facilities while maintaining the appropriate temperature. So I'm pleased to say that every dose we've received has either been used or is allocated for use in the next few weeks. We're fortunate in Nova Scotia that we are in a different position than other Canadian provinces, that our epidemiology allows us to make decisions such as holding back the product to ensure that we can give people the second dose. It's also good practice because the data on the effectiveness of the COVID vaccine products is based on 2 doses, not on a single dose. And we also have to have some contingencies given the unpredictability of weather events during our Nova Scotia winter. We have about 200,000 people in our highest priority groups, frontline healthcare workers that are directly involved in the COVID response. There are people in long-term care sectors, both residents and staff, as well as community living seniors 75 and older. We expect to begin to be able to immunize a significant proportion of all these people in phase 1, and we'll be able to then continue to immunize the rest of them as we begin in phase 2 and move beyond that as well into other healthcare workers and other people whose jobs are considered critically important within the province. And that is likely that is going to be into late April into the spring, May and June as phase 2. And then our phase 3, which will begin in the summer, will include all other Nova Scotians, people who weren't included in the initial phases 1 and 2, but also if for some reason people who were identified as a priority group in phase 1 or 2 did not get immunized along with everybody else in that group, they won't lose their place in line, if you will. When they become forward for vaccination, they will be able to get vaccinated. We have developed 5 storage sites for vaccine in the province, and we have the appropriate fridges and both regular temperature and ultra-low temperature freezers in all of these 5 sites. Shipments will be happening to Cape Breton Regional and Valley Regional Hospital this week, and they'll be beginning their clinics starting the week of January 11th. And then we have additional shipments that are going to Colchester East Hants Health Centre the week of January 11th, and they'll be starting clinics for January 18th. And these clinics will be, like we've done in Halifax, for acute care healthcare workers, long-term care residents, long-term care staff who are able to come to those clinics in the hospital. And as we get more Moderna vaccine, we will begin, like we've started with the largest facilities of long-term care facilities in Halifax, we'll begin to be able to deliver that vaccine to long-term care facilities across the province. So things are moving quickly, but we have to understand that the product itself is coming in relatively small amounts week by week. So our goal is to vaccinate as many people as quickly as possible with the product that we will be receiving. But we need to acknowledge and understand that this is by far the most complex vaccine program that we have ever implemented. So in phase 1, with a limited number of doses, we'll be testing and evaluating a number of different vaccine delivery models, which will help us to ensure that we are ready to deliver much larger amounts of vaccine as we enter phase 2. As I talk about this with my team, we really talk about phase 1. We have priority groups, but as an objective, but a key objective we also have is to prototype and test and adjust various models of delivery and clinics for vaccinating people in phase 1. So when we have limited amount of vaccine, and what that does is puts us in a position to be ready when we get much larger amounts of vaccine in phase 2. We're not trying to figure out how to deliver that. We've done all that work in phase 1. So the speed of this will slowly increase, and by the time we get to the spring with phase 2, our objective is to deliver as much as 10,000 doses of vaccine per day. And as the Premier said, we will keep sharing information with Nova Scotians throughout this process. We will do it at our regular briefings, and starting next week, we will be reporting vaccine data weekly on our website as well. So with our vaccine rollout underway, our 3-pronged approach to COVID is now a 4-pronged approach. Public health follow-up of cases and contacts, our COVID control measures and restrictions, our various testing strategies, and now vaccination. These are all important elements of our COVID response plan, and they're going to continue to be important in the months ahead. Our asymptomatic and symptomatic testing has continued through the holidays, and we're ramping that back up again. So in addition to the tests that people can book online, so as a reminder, if you're feeling unwell in any way, you should go do the online assessment and get direction on whether you should be tested. But also if you don't have any symptoms, we encourage people they can go online and get book for a test even if they don't have symptoms. We encourage people to do that, and we also are having the pop-up clinics that will be occurring in communities across the province as well. We are also targeting asymptomatic testing to both rotational workers and our returning post-secondary students. So for rotational workers, they are strongly encouraged to test for COVID on the first or second day of their return to the province as part of their 2-week modified quarantine, and then again on day 6 to 8. A negative test doesn't replace their modified isolation, but it does offer further reassurance for other members of their household that they themselves are not going to are not infectious and able to take that out into communities. We're also starting to welcome our post-secondary students back to Nova Scotia this week. Like any other travelers, any students coming from outside Atlantic Canada must complete a 14-day quarantine. We continue to work closely with our university and community college partners and student associations to make sure that this can happen. And during that 14-day isolation period, again, we are strongly encouraging any students under quarantine to do the daily digital check-in that they have to do daily is every day. So they are required to do the daily digital check-in, but we're also asking them to go online 3 days in advance so they can book a COVID test on day 6 to 8 of their quarantine period. So right now we have COVID-19 cases in all areas of the province across all health zones. There isn't a single hotspot. So COVID is very much, the potential for COVID is here regardless of what community you are in Nova Scotia. But I'm still hearing stories about people being refused service or denied entrance on the basis of travel within the province, especially people who are coming from or have been in Halifax. We've also heard stories about rotational workers who continue to be targeted within their communities, as well as their families and children. And I've heard disturbing stories that we are hearing instances of serious and intimidating communication to these individuals and families. This is unacceptable. We cannot tolerate such behavior in our communities. I know there is fear and anxiety out there around COVID-19. And I know that people are trying to keep themselves, their families, and communities safe. But I also know that shaming and blaming people does not prevent the spread of COVID-19. Shaming and blaming creates stigma. It drives people underground. And when we drive them underground, we lose our ability to work with them and help keep our communities safe entirely. And we need to be able to have people to be open and transparent about their activities, about their travel, so we can work with them around testing and keep our community safe. So being exposed to COVID, testing positive, even if you've transmitted the virus to somebody else, these are not things to focus blame on. We are in the midst of a pandemic. People are going to test positive, and we need to accept that. We certainly need to hold ourselves to a high standard and take every reasonable precaution that we can to keep ourselves, our families, and our community safe. But we also need to recognize that everyone's situation is different, and that while things do need to be different right now, life must go on. Our goal right now is to keep our numbers as low as possible, and we're doing that. But we have to be realistic, and it's not realistic to expect that we will have no COVID at all. And certainly not while so many others around us, even within our country, are in the middle of a huge Wave 2 surge. And we also have to recognize that some Nova Scotians are at higher risk of getting COVID than others for a whole host of reasons. For some people, it's their work. They have to travel outside the province, or they work in a setting that puts them at risk. Social activities, too, always carry a risk of exposure, even within the limits of numbers that we have placed. And what we're working very hard to do is not have super spreader events where we have a large number of new cases from a single exposure. So we need people to be as safe as possible. We need to make choices that keep ourselves and our community safe. And we need to act out of a place of caution, but not fear. My colleague, Dr. Barrett, continues to say we have to live our lives. We just have to do it in a way that is COVID safe. So this is part of our new normal, living COVID safe. And we also can't, we have to accept that we just can't assume that everyone's situation is like ours, because it's not. We don't know what other battles and challenges people may be having as they deal with COVID, along with all sorts of other issues that we have. So we need to be caring to our neighbors. We need to have compassion for people in our communities, even if they may be a case of COVID or may be identified as a contact. We don't know their story. And we need to be good to one another. So that's the energy I'm taking into 2021, and I ask you to do the same. Caring, compassion, building up community, not blaming and shaming. And with a commitment to do the very best we can all together. Premier.
Thank you, Dr. Strang, and Chrissy would be happy to take any questions.
We'll do one question and one follow-up in the amount of time that we have for today. First question will go to CBC's Mike Gorman.
Thanks. Dr. Strang, when you talk about these pilot efforts to look at alternative distribution methods, I presume you're thinking about things like pharmacies and doctors' offices, could you talk a bit about what it is you and your colleagues need to see before you're ready to move beyond simply vaccinating at the existing storage sites?
So a lot of it is actually around the transport of vaccine. I'll give you a real-life example. We got Moderna vaccine on December 30th. Over the last few days, we were piloting how we ship that vaccine from the vaccine storage in public health offices in Burnside to Northwood, their Halifax campus. We were doing everything with the containers, the ice packs, etc., without actual vaccine. Just to test, could we maintain the temperature? The first time we did it, we used a certain method, and actually it failed. We weren't able to maintain the temperature, but even between the travel from Burnside to Northwood. Good thing we didn't have vaccine. We would have wasted that vaccine. We did it again with a different method, and now we actually were able to maintain the temperature of the vaccine. So now we have the ability, with the right processes, to safely ship the vaccine from Burnside to our Halifax long-term care facilities. That may seem like a simple example, but we have to test all these things out before we actually do it with vaccine. So that's all the processes we have to do. It becomes long. We now have to figure out how we ship vaccine from our other regional centers to other long-term care facilities where there may be a greater distance to travel. So each of those steps may seem simple, but they have to be tested and tried out so we know that we can do it safely before we actually put vaccine into that distribution chain, if you will. We also have to start looking at what are the different types of clinics. Right now at our hospital-based clinics, we're using a combination of occupational health and public health workers. Once we get into bigger volumes of vaccine and in phase 2 with broader range of Nova Scotians, we're going to need to have other models of community-based clinics that have to be different than what we used during H1N1, which was very much based just on public health. We're going to have to look at how we bring a range of healthcare providers, all of who are able to vaccinate people safely, along with a range of perhaps volunteers from the community, because running a community clinic for several days, there's a lot of work that has to go on that is far beyond just actually immunizing people. So we need to develop the partnerships, try out these different models, and then so when we actually do have to have these types of clinics, we've tested them and tried them out, just like shipping the vaccine product. So part of our planning in phase 1 in February and March is to pilot some of these different types of clinics with different types of providers, work through all the bugs, if you will. So again, phase 1 is very much part of phase 1 is very much about trying things out, testing them, making sure they work or what we need to adjust, because we have to have those all in place once we get into phase 2. And as I said, our target may be as high as 10,000 doses of vaccine a day. This is very complex, and you don't go from 0 to 100 in a week or two. It takes some time as we scale up. But I'm very comfortable and confident that we are taking the right steps so we can scale up appropriately and we're not having vaccines sitting around. We are using it in a timely manner, but we're also doing things so once we get larger amounts of vaccine, we will deliver that vaccine in a safe and timely manner as well.
Go ahead with your follow-up, Mike.
Thanks. The other prep work I understand, Dr. Strang, that's happening during phase 1 ahead of phase 2 is to determine who exactly qualifies as an essential worker to receive the vaccine. I know that folks who have underlying conditions that put them at risk who are younger than 75 are also wondering where they come in the pecking order. How much leeway does the province have to make that determination itself versus following and adhering to whatever national guidelines come out of the organizations that you're working with?
So we certainly are. We always strive to follow the guidance around vaccines from the National Advisory Committee on Immunization. They have given a high-level framework around how to prioritize the COVID vaccines. But within that, there's lots of scope for each province to take that, as you said, the example you used, who we define as an essential worker and what makes sense in the Nova Scotia context is who is vitally important to make sure that they're protected as an early priority with COVID vaccine. That may be different in Nova Scotia than it is in Ontario. So there's lots of room to stay within the NACI guidance, but also do our own thinking and our own work. As you heard at the technical briefing, Dr. Watson-Creed is leading a process, a very detailed process around how we actually define when we get into phase 2 around who is deemed an essential worker. I don't actually like that term because if you're somehow it seems if you're not on that list, the message is we're not telling you you're essential. It's just really people who are critically important that we make sure that they're further up on the list to get protected from COVID because we need them to be at work. So we're doing a lot of that work. We're also working with our clinical colleagues around how we might prioritize what do we know about the COVID illness itself and what types of medical conditions put people at greater risk. We certainly know that by far the biggest risk factor for severe COVID illness is age, and that's why we're following the NACI guidance. As soon as we get into communities, we're starting with people who are 75 plus, but we'll also be looking at what is the evidence around different types of health conditions as well and how we might get vaccine to people in those groups or earlier on. The third piece is we know that many of our communities are marginalized and for socioeconomic reasons are more vulnerable to COVID. And we're certainly starting to do the work as a priority in phase 2 about how do we identify, work with marginalized communities to make sure that they are made a priority for receiving COVID vaccine as well.
Next question will go to Jesse Thomas with Global.
Thanks so much. I guess following up on maybe just some of the challenges we heard you talk about distribution and keeping the vaccines in particular at certain temperature ranges. I'm just wondering, as we look at goals like having 75% of the population vaccinated by the end of September, what are the challenges to getting there and the 10,000 immunizations a day? Is the next biggest challenge maybe staffing? Maybe you can talk about that.
So I think the biggest challenge is what is the models, and I'm using plural deliberately because it's not just one model. What are the different types of community-based clinics that we can hold across the province? What is the range of healthcare providers? This is not just about public health-based clinics like we did in H1N1. Public health needs to play a lead role. We have the expertise in this, but we need lots of other people, and there are many other people in the healthcare system, even beyond healthcare, who already know how to deliver a needle. It may not be a vaccine needle. There's lots of people that we can train to actually put a needle in somebody's arm. So but it's not just putting a needle in somebody's arm. To run a clinic, you need people to a whole range of other work that has to happen to successfully run a clinic. So we're in the process of really starting to develop the detailed plans for those different types of clinics. We're going to try some of them out in phase 1. Part of this is building, on our existing relationship with regulatory colleges, with, I'll use examples, with Doctors Nova Scotia, with the Pharmacy Association of Nova Scotia, the dentists, veterinarians, lots of other folks who we can easily train to deliver a vaccine. We need to start to engage them and say what role could they potentially play in a broad range of vaccinators, and then what role can communities play in volunteering to help support a vaccine clinic when it shows up in their community.
Go ahead with your follow-up, Jesse.
Thank you. I guess 10,000 immunizations a day. How do we come up with that number, and do you think that might be realistic by September to get there in terms of a timeline?
So that's simply based on the predicted delivery of the amounts of vaccine we'll start to get when we get into phase 2, and our objective will be to meet that. We have to wait to get those numbers validated, but clearly we need to be in a position to use in a timely manner whatever vaccine we get.
Next question will go to Natasha Pace with CTV.
Hi there. Thank you. Dr. Strang, I understand that there's still a lot of work happening and that the vaccine has only been around for a few weeks, but there appears to be a shortage of people who can give the shot. There's a lot of job postings online, and I'm wondering if that's affecting the rollout. A lot of people are concerned about how Nova Scotia is lagging behind and perhaps not rolling out the vaccine as quick as we could be.
No, staffing is not an issue. We have the people we need to deliver the amounts of vaccine we're getting in phase 1, and as I've just talked about, NSHA Public Health is looking to recruit more people to do their work, but we need to think we think far beyond just having more people in public health. This is a range of healthcare providers and others that we need to start working with, but in these early phases, our human resources is not a barrier to us delivering the vaccine. I'm going to push back a bit on the narrative that we're slow in getting the vaccine out. We got vaccine on December 15th. We immunized people that day. We continue to immunize them. We set aside the appropriate amount of vaccine to deliver to start immunizing those people with a second dose. The first day we can do that is January 6th. We are immunizing people starting January 6th. We have the Moderna vaccine, which came on December 30th. Very soon we're going to get that vaccine out to long-term care facilities and start immunizing people. We have not been slow.
I just want to confirm to all Nova Scotians that they have not been slow. The province has been doing, through public health, a tremendous job of ensuring that the vaccine that we have in our province is actually going into the arms of Nova Scotians. So the Pfizer vaccine is there. We have supply for a second dose. The Moderna arrived on the 30th of December. We already are starting to use that product. And I want to reassure Nova Scotians, one of the things that I think is really important, if you go back and look over the last 3 months and the way we've diversified how we test Nova Scotians, it became a period of time we used pop-up clinics, mobile units, we had our current fixed structures. All of that allowed us to ramp up testing to a substantial number, in some cases almost 4,000 a day at one point. What we're doing in the front end of this, and what public health is doing in the front end of this, which I don't know if is happening anywhere else in the province, is looking at various delivery models, so that not because we're going to slow down the vaccine that we currently have, we're going to use those models to deliver the current smaller numbers of vaccine that'll show up in the next 2 months, so that in April, when we start getting about 10,000 doses, we have the capacity, we've already tested those models, to put those in the arms of Nova Scotians as quickly as possible. Public health has done a tremendous job of ensuring that we look at diversity of how we deliver this vaccine, but also at the rate we deliver this vaccine. And when we do, we're doing it properly. So anyone who suggests that public health is sitting on vaccines in this province is just not accurate, and it's not true.
Go ahead with your follow-up, Natasha.
Thank you. Just wanted to clarify something. The 3,700 doses of the Moderna vaccine that the province received on December 30th, I understand they're reserved for long-term care. When do you actually expect the first shots from that specific Moderna vaccine group to be in the arms of people in long-term care homes?
Those final arrangements are being made. As I said, we just today actually figured out that the shipping piece, we're trying a different method. I expect that very soon. We're just working out those final details with the long-term care facilities themselves.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Dr. Strang, I understand that some designated support people in nursing homes have been vaccinated in phase 0 alongside COVID healthcare workers, IWK birth unit, and long-term care workers in the central zone. Can you help me understand why designated support people are placed higher on the priority list than Halifax paramedics or home care workers, considering both work in nursing homes and houses and hospitals, as opposed to designated support people who are not nursing home residents or healthcare workers?
So if you look at a long-term care facility, we have, any resident can designate, now it's up to 2 designated support people. They're in there on a regular basis providing care alongside long-term care staff. It only makes sense that we are allowing them to be vaccinated as part of that whole team that's working in the long-term care facility to provide various types of care and support to the residents.
Go ahead with your follow-up, Lindsay.
Thanks. Changing gears, regarding the Can Immunize contract, that $1.17 million the government's paid for this, will people actually be using the apps themselves and asked to download it? How will this tracking of the 2 doses of vaccines actually be managed through Can Immunize?
So there's a team of folks in the IT world who are working on this. I'm not directly involved, but there's 2 components to Can Immunize that we're working on. One is the Can Immunize to be able to use that as a registration process and collecting data at the clinics. The other piece is about individuals downloading the Can Immunize app, and they will be able to, if they have that Can Immunize app, my understanding is when they can ahead of their clinic, they can actually put a lot of information in, and when they come to the clinic, that information can be read from the app into the Can Immunize technology that's at the clinic. Once they're immunized, the vaccine information goes into the database, if you will, at the clinic, but it can also then be uploaded back onto the individual's Can Immunize app themselves. So they will leave the clinic with information about the vaccine they just got. We will also have the appropriate information at the clinic that we need to make sure we have accurate numbers about who got vaccinated with what product. That's important to make sure we're monitoring our vaccine coverage. It's also important that if any individual has an adverse event, we have very clear information on what type of vaccine they got, where and when. So that's all those are the IT products that are being worked on through the Can Immunize approach.
Next question will go to John McPhee with the Herald.
Thank you. Dr. Strang, can you speak about the outbreak at Churchill Academy in Dartmouth? I believe 7 cases have been identified, including 5 on weekend, but there have been no other cases so far. So it appears that outbreak has been contained, or is it too early to say?
No, I mean, we identified believe the initial case that associated with that school on December 29th. It was somebody who had been at the school the last 2 days, December 17th, 18th, and they came to our attention through testing and through the follow-up was identified they were infectious while they were at the school. We then, as we do with every school, identified, who were the close contacts of that case and test them. And through that testing, we identified a number of additional cases. You're right that the total number is 7. And then, it was December 31st and January 1st that we began testing every staff member, every student in that school. And so far, there's been no additional positives from that. So it appears that, I'm very comfortable. I mean, we've approached this like any other school. It's the first school that we actually say we have had an outbreak within the school, and we're looking at some of the specific circumstances around that. This is a private school for children with a range of different learning needs, and so we're looking at that, or what are some of the unique characteristics perhaps in that school which led to an outbreak. But we've also put all the right steps in place to bring that outbreak under control in a very timely manner.
Go ahead with your follow-up, John.
Thank you. Premier, today the Prime Minister said he'll be talking to provincial officials Thursday about their vaccination programs. I'm not sure if you're going to be on that call or if it's going to be another representative, but I'm just wondering, are you happy with how the federal government has dealt with the vaccine delivery? Would you be expressing any concerns about how they've dealt with things?
So I will definitely be on that call. If you go back to the very beginning, it's being delivered on a per capita basis. If you looked at the Pfizer vaccine, they had to be kept a bit around -70. Northern Canada didn't receive any of that vaccine because of the complexity of shipping it up north. Now that the Moderna vaccine is here, more of that will end up north to compensate for the lack of Pfizer that went up. But will continue to be delivered to us on a per capita basis. We're going to be watching to ensure that that vaccine continues to roll in weekly, that they keep the timeline. They've assured us, assured all Canadians that they have contracts with a number of potential companies that will be producing a vaccine, and our job will be is how do we deliver that? And I'm really comfortable and proud of the work that's been happening internally inside of our province to prepare for the day when we start getting large quantities of vaccine, because our priority, our goal, and our job, quite frankly, is when that vaccine arrives to our province that we get it in the arms of Nova Scotians as quickly as possible. And that's what we're doing in the front end, is testing all of these different strategies to ensure that that vaccine is received and then delivered into the arms of Nova Scotians quickly.
Next question will go to Danielle Edwards with the Canadian Press.
Hi, yeah, I think this question is probably best directed to Dr. Strang, but I kind of wanted to ask a little bit about the specific details on how the vaccine is currently being administered to healthcare workers and some residents. Is it happening on a day-to-day basis, or is there more space between each of the vaccination events in the schedule? I just wanted to see how long the province expects the second doses of the vaccine to be rolled out.
I don't have the daily clinic schedule in front of me, but knowing that we're getting certain amounts of vaccine per week, and I think at the technical briefing there was more information on that provided. We certainly are scheduling clinics at our certain base in Halifax, and as I said earlier, moving them out to other hospitals as well. And the scheduling of those clinics will be done so we can deliver in a timely manner the vaccines that we're getting on a weekly basis.
Go ahead with your follow-up, Danielle.
And I also wanted to ask a little bit about when the public is going to receive information about how many vaccinations have taken place. Will that be on a daily basis or a weekly basis?
As I said in my remarks, starting next week, we'll be delivering on every Tuesday. We'll be giving updated on vaccination numbers.
Next question will go to Paul Legier with Radio Canada.
Yes, I'm just wondering, there was talk about possible Atlantic bubble once again. What would it take to get a new Atlantic bubble, and would that be threatened by the number of 27 cases in New Brunswick today?
We have not actually closed the Atlantic bubble. Atlantic Canadians are able to come into our province without isolating, continue to access health services. We've asked them to follow the public health protocols, but we have not closed the Atlantic bubble. We've been welcoming people from the Atlantic region over really since last summer. That would be a better question for our neighboring or our sister provinces here in Atlantic Canada.
Go ahead with your follow-up, Paul.
Yeah, the sports reporters were asking me if I could inquire about organized sports such as the Maritime Hockey League or the Quebec Major Junior Hockey League that are not active right now. What will we need to permit the return of their games, and in what context?
So there's two things. I'm not looking specifically at the higher levels of hockey, but we're certainly looking at organized sports in general. That's part of our review of our restrictions. Right now we're allowing up to 25 people for sports or theater events, only for practices or rehearsals. So we'll be looking at that, and one of the decisions we need to look at is, do we go back to where we were a couple of months ago, where we allowed up to 50 people, and games and competitions were part of that. That's one component for things like the Maritime Hockey League and the Quebec Major Hockey League. The other component for them is actually what are the rules around audiences and spectators. So both of those components have to to be in place, but our priority will continue to make sure that we make decisions based on the safety of Nova Scotians, and at the same time balancing opportunities more broadly for both arts, cultural events, as well as physical activity, sports, and other recreation events. And if it so happens that those also allow higher levels of hockey to play, great, but we're not going to do things specifically for those just to accommodate higher levels of sport.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, good afternoon. Several of my questions have already been asked, so I'll go down the list. I asked this at the technical briefing and didn't really understand the answer. The current vaccines are very effective, 95%, but they're limited in numbers, and there's the expectation that Health Canada will soon approve other vaccines, but they are not as effective, maybe down as low as 70%. I'm wondering what your thinking is in terms of how those vaccines might be put into the mix. Will they just be thrown out there as part of the regular mix, or will other people get them, or how will that play out?
So that's an area of the technicalities. We'd look for guidance from the National Advisory Committee on Immunization. You have to understand that all of these ranges of effectiveness is not a single number. There's a range of effectiveness. All of them come from somewhat limited or clinical trials that are at this point in time limited in time. For instance, we know with Pfizer that it's highly effective, but we can only say it's effective for 4 to 8 weeks after you've gotten your second dose, simply because the clinical trials haven't gone on long enough. At the end of the day, does the different ranges of effectiveness in clinical trials translate into much of a difference between one vaccine for another and how we use them? Again, we rely on the highly technical expertise at a body like the National Advisory Committee on Immunization to help guide us through those kind of questions when the other vaccines become available.
Go ahead with your follow-up, Tim.
Yeah, just a quick technical question. In some days past, Nova Scotia has been attributed to having positive cases. People aren't even in the province. They're in some other province, but they're residents of Nova Scotia. I understand what the logic behind that. My question is there the reverse case? Are there people who are residents of other provinces who test positive in Nova Scotia? And if so, are there lots of them, or few of them, or are we told about them?
No, we don't include them in our provincial numbers, but off the top of my head, I can recall a couple of circumstances of people from other provinces who have tested positive here. We refer that over to that province, and it's included in their numbers.
Next question will go to Victoria Walton with the Coast.
Thank you. This question, I know we talked a little bit about New Brunswick borders and the 27 cases they announced there just today. They also have a return to what they're calling Code Orange. And I'm kind of wondering, the reverse is whether we'll be thinking about closing those borders to New Brunswick if their cases continue to go up. How long would it take for that to happen?
Well, that's something that we've looked at today. We'll continue to watch what's happening within our sister provinces. But again, when the Atlantic bubble was broken, it was those provinces that did it. It was not Nova Scotia. As you know, we are the center of many the Children's Hospital here in Atlantic Canada. Our regional hospital provides services to many people outside of Nova Scotia. We wanted to ensure that as long as we could, those services would continue, but we'll continue to monitor it. But my first and foremost wishes and hope is that public health in New Brunswick and the government of Brunswick continue to do the job they've been doing. A great job of whenever they've had an outbreak, they've contained it, controlled it, and allowed us to continue to move in and about Atlantic Canada.
Next, go ahead with your follow-up, Victoria.
Thanks. This question is about post-secondary students. You talked a little bit about how they're coming back and are recommended to get a test. But I know previously in September when we had our incoming wave of post-secondary students, it was mandatory for them to get, I believe, 3 tests. I was wondering why that's not the same case this time around.
So when we looked at the two things, it was mandatory in name only. We really had no way to enforce that, no way to ensure that it was happening. So as we talked about it, we really realized that we don't want to be in a position of calling something mandatory when it actually we can't enforce that. So we're working with all those students and on the premise that the vast majority of them will come forward and get tested. When we looked at the information, the 3 tests in September, the conclusion we came to was that the 3 tests weren't necessary, that we can appropriately supplement the required 14-day quarantine with a single test a day in the middle of that quarantine is the recommended approach from our kind of clinical colleagues and is the approach that we have chosen.
That's all the time that we have today for questions.
Thank you, Irwin. I hope that our discussion today around our vaccine rollout offers you some level of reassurance. As Dr. Strang has said, we have never done anything like this before. This is all new to all of us. But I want you to know everyone is working extremely hard. Dr. Strang and his team, Minister of Health and the department, and of course Nova Scotia Health and the frontline healthcare workers across our province. We all want to get this right, and it will take time, but the vaccine is here, and we have a strategy, and anyone who wants to get vaccinated will be. We just have to be patient while this program rolls out. We will continue to follow all of the public health protocols to ensure that we protect one another. Once again, we've opened up our province a little bit more. Now all of the restaurants across the province will be open to dine-in services. And I want to thank the entrepreneurs in our province. I know shutting you down and then reopening again has been difficult on you, but this time we want to keep you open, and we'll do all we can to support you during that period of time. And my encouragement to all Nova Scotians is to shop local. But we need to do this in a way that keeps everyone safe. We are so close now that we are expecting a regular shipment of vaccine. We cannot, I want to repeat, we cannot let up now. So let's do what we've been doing for the last 10 months. Let's follow the protocols, focus on keeping each other safe, and continue working together to combat COVID. And before I go, I just want to wish Team Canada all the best tonight as they go for gold.